Hello everybody, I'm Sarah. Welcome to my presentation of Professor Cato's Part 4 Organizational Change Proposal. Today I will be providing you all with some insight into the last 3 organizational behavior and theory assignments. With my analyzations, I will then use my interpretations to develop a change proposal that is designed to remold the standards of practice at I'm a nurse's assistant as well as a health unit coordinator at Overlake Hospital Medical Center and have been working there for just over a year. Currently, my home base is in the surgical pavilion. Even though I have been working there for only a year, I feel as if I have gained a level of insight that is greater than any level I have received at my previous jobs. In this slide, I will be giving you a brief overview of my past analyses as well as pointing out any possible manifestations of an issue. We start off with our first project that was due back in April. The objective of that assignment was to analyze organizational performance from a strategic level. Through some time, research, and experience, I was able to learn a few key factors that play into the organization's success. Built in 1960, Overlake is a nonprofit healthcare organization that provides quality tertiary care to residents of the growing East Side. The mission is compassionate care for every life we touch, and its values are the acronym of ICARE: integrity, compassion, agility, respect, and engagement, which all consist of standards that drive our behaviors and decision making. With great values such as Overlake Hospitals comes great responsibility. In part 1 of the individual project, I pointed out several different variables that play a toll on the level of care a healthcare provider can give, some of which include language barriers, lack of health literacy, and lack of professional courtesy towards one another. As the East Side community continues to grow and expand, the diversity of patient care continues to grow as well. We are fortunate enough to provide unbiased care, but there are times where it can be difficult to relay care into a foreign language. Thankfully, we have a translating system. However, through personal experience, it can be very difficult getting a hold of somebody. There are more common foreign languages that have readily available translators, but in the late hours of the emergency room, there might be instances where a translator is unavailable. Translators play a huge role on patients. Family might not be available at the time, so the language barrier can cause a sense of anxiety on a patient, resulting in a sense of restraint when trying to suggest that having surgery is necessary. Personally, even though I work in healthcare, there are certain policies and procedures that I am still unaware of. I can't imagine the level of anxiety a patient has when they experience the same. The second variable I explained was lack in health literacy. Lack of health literacy can also tie into the language barrier between patients and providers. Whether some individuals like it or not, we as a country are experiencing a growth in immigration. The increase in diversity is both positive and inevitable. Healthcare policies in foreign countries can be drastically different than our policies here in this country. So on top of language barriers, different cultures and levels of healthcare knowledge can also prove to be difficult to deal with in critical times. The last variable I pointed out was the lack of professional courtesy towards one another, which is an issue that can potentially manifest into a bigger one, as it can ultimately play a vital role in the quality of care a patient receives. It can be difficult to work with someone who shows no sympathy towards teammates or even the slightest bit of professional courtesy. Tensions can rise. I can say from personal experience that even though tensions can be high, the patients will always be kept at the heart of no matter what we do. Although we are all capable of resolving foreign language barriers and healthcare policies, it is ultimately up to us as caregivers to uphold our organization's mission and values. A problem that I have learned to identify is the potential risk of negative professional courtesy towards one another. Currently, professional courtesy affects individuals on the smaller scale, but this type of issue can cause a rippling effect as it can turn to tensions between other units. Our unit serves as one of the main hubs of hospital care, as people who come to us in times of healthcare needs, which oftentimes results in some type of either invasive or non-invasive procedure. Certain unnamed providers place blame on each other, which is a huge factor in courtesy. One of the practices in our strategic plan is to make sure we are utilizing a positive team based approach in order for success in the vitality of a patient. In part 2 of our individual project, we were asked to examine the 6 elements of organizational design and provide an overview into our current organization's strategic plan as well as our organizational chart. In short, the 6 elements of organizational design were of the following: differentiation and integration, authority and control, and finally specialization and coordination. Through the help of my manager, I was able to identify our current organization's strategic plan and was able to expand on the characteristics of what played into my organization's success. We are focusing on delivering exceptional quality and superior patient experience, coordinate leading edge care, creating a culture that inspires, and finally position Overlake to serve the East Side for all future generations to come. One of the main transformational projects we are working on is Project Future Care. It's the cultivation of a brand new state-of-the-art facility that will feature brand new units such as labor and delivery and oncology. Another one of the concepts in our values is to respect and provide compassionate care. One of the elements that I highlighted was the level of specialization and coordination involved in order for success in a patient's vitality. Through the organizational design, the level of specialization differs. I pointed out that specialization tends to increase the higher up you go on the organizational chart and decrease as you go lower. The level of specialization coincides with the level of coordination. It is imperative that coordination is high because there are so many variables that play into a patient's stay at the hospital. I believe that open communication is one of the most important universal characteristics to possess because misguided communication can have a severe negative effect. When there is a sense of imbalance in one of these elements, it can ultimately slow down the process of quality of care, which in turn can cause restraint on employee morale and effective decision making. Let us use the example of adding on an emergency case. So when a patient gets admitted to the hospital due to severe pain in the lower abdominal region, either the patient's doctor or someone on the healthcare team will evaluate and determine if scheduling a procedure is necessary or not. More often than not, the pain in the lower right abdominal region usually means some form of appendicitis. In layman's term, it's just an infection of the appendix, which usually results in a laparoscopic removal. In order to successfully coordinate the emergent procedure, proper coordination and communication must be done. The emergency room must coordinate with the proper doctor, then the doctor must coordinate with us in inpatient surgery in order to book the actual procedure. Once the procedure is booked and the patient understands the need for invasive surgery, involving parties such as pre-operational unit, so PCU, or surgical materials, as well as the anesthesiologists, must be notified immediately because of the limited time constraint that we have. Prepping a patient for surgery usually takes about 2 hours to do, but depending on the criticality, I have helped a patient get prepped in like the blink of an eye. Getting the patient on the surgical bed takes proper and effective communication, and when there is an imbalance, it can ultimately cause us to slow down the process, which then causes a restraint on relationship between the surgeon and supporting staff. Surgeons are very high maintenance. Some require every single I to be dotted, some don't. But in short, the imbalance in communication can greatly influence overall employee morale because if a surgeon is not happy, then they'll make everyone else feel the same way. In part 3 of our individual project, our objective was to examine the current practices and correctly correlate them to the concepts we learned from session 5 to session 9. Through this objective, I was able to evaluate on the idea that ineffective communication can cause restraint or hinder the level of employee morale, which also plays a role in conflict resolution. It is important to understand that the problem that can manifest into a bigger issue because there are so many parties involved when it comes to a patient's healthcare team. One of the many variables that result in successful conflict resolution involves proper flow of communication and high levels of employee morale. Enjoyment of a workplace environment is also an important factor in creating a positive teamwork environment. In this slide, I have prioritized the issues I have potentially identified based on their level of impact on employee morale, productivity, organization's strategic plan, and overall organizational effectiveness. Here I have them listed from the highest impact to low, but in the next following slides I will be discussing them in the opposite order, as I believe the highest impact based on the criteria should be left for last. I've determined that other than patient safety, the dynamic of the team is also a crucial part of the healthcare system. Overall employee morale should be high as the level of stress is high the moment a patient gets admitted into the hospital. The bigger support you have from your teammates greatly influences the level of positivity each person has the moment they clock in. Next in my prioritization list comes the negative effects on fluctuation and of communication flow. Then lastly, the level of maturity and competency from the supporting staff. First, we will start off by identifying the problem with the lowest priority, which is the lack of competency and maturity that is displayed amongst certain individuals. The reason I placed this low was because even though individuals can have a great impact on the team, ultimately the entire team knows to separate themselves from negative situations or people. Having a lack of competency means a person does not possess the ability to complete a task to the fullest content. There are some individuals in my workplace that need to realize the potential risks that lack in competency might result in. Maturity is a great influence as well. Positive maturity means a person displays proper professional courtesy. Nobody on this earth ever wants to work with a bully. And in a high-stress environment, the last thing anybody needs is somebody or someone to be condescending and judgmental. These tensions can be caused by a variety of things, but one thing that comes to mind is surgeons being very demanding. It is important to have a supportive staff because not only does it promote a positive work culture, it also promotes for successful and compassionate care towards a patient. God forbid a surgery start time runs 2 minutes late, which is almost always the case, but it's okay. In this slide, I will be briefly discussing the impact on the fluctuation of communication flow. Not only is communication important, consistency of effective communication is important as well. Staff members support one another, and when the communication line is affected, then the patient is the one who suffers, because there is ultimately a delay in care. Some of the problems I've noted was due to a lagging test results, unavailability from supporting team members, lack of or misread orders on patients. Doctors are the ones who places orders on patients, and sometimes doctors will forget to submit those orders. In this slide, I will base my analyzation off of the previous two assumptions, as I believe they play a part in employee morale. I place this problem as the highest on my impact list because I believe that a lack of maturity and competency can cause an employee to change styles in conflict resolution, which in turn can cause a lack of effective communication, which then turns into a decrease in overall employee morale, which then will lead to a decrease in productivity and efficiency. I believe that determining the proper intervention can have a positive effect on employee morale because the main areas I want to influence as a manager are improving interdepartmental relationships, which can boost overall morale, address communication barriers, and finally offer a level of guidance and support other managers and staff can bring to other people. Through the human process intervention developed by Cummings and Worley in 1997, I am able to address these issues between people in the department. Also, understanding Kurt Lewin's three-step change model will help me further implement a change proposal, as his concepts promote the idea of remodeling an area of need and molding it into a more effective piece that will overall improve the organization's success. His concept is that through unfreezing, you must first be sure that employees are ready for such change. Employees must be reassured that the reason for change is due to an area of need that will positively deal with, and all opposing forces that play into resistance must be established and dealt with so no further or so for with so that further implementation can be successful. When employees are ready for change, then we are ready to implement that change. Upon implementation, we must ensure that the changes become consistent and permanent. Change within a healthcare system is always inevitable. It is inescapable because this is an environment that is always evolving. I believe people that work in healthcare already have a basis of understanding this concept, which makes for change easier than one who is completely resistant. I have worked for a company that never promoted change, and anybody who did was immediately fired. To have a staff that is supportive really does have a positive effect on change because you have trust in the employees to further carry out the change. My intended implementation plan incorporates Lewin's change model in that it helps to address the areas of need, which are a decrease in employee morale, fluctuation of communication flow, and lack of competency and maturity. People will always be hesitant at first to change, but this is my duty as a manager to understand this process so that I may effectively manage the areas of need in order to promote a positive and successful culture. By terms of unfreezing, I will establish a secure line of trust and assurance so that I know my employees are ready for change. If they are not competent enough, then I reassure them that the purpose of this change is for the overall quality of care of the patient. The actual change would simply be to evaluate current communication methods and raise any areas of concern through email or staff meetings so that my employees will understand that proper communication is important not only for the patient but for the overall employee morale. And the acting of refreezing means I would in time follow up with my employees to ensure that there are not any residual problems before and that we are keeping consistent in communication culture. I need to also ensure that this new molding will stay in place because a positive work environment promotes a positive patient experience. Thank you for your time, everybody. I had a great time with you guys throughout this quarter, and I wish you all good luck on your future endeavors. Until next time, bye bye.